Hello guys. Do you actually know that the most important medicine in the world cannot be made in a laboratory? Rather, it cannot be bought. It's not something that you cannot manufacture. But well, you can give it to someone else. I know what you're thinking, but don't be a pervert. It's blood. Blood is one of the most important concepts in medicine, blood transfusion rather. This has helped millions of lives every day. Every time mothers go through child complications, they need a blood transfusion. Blood helps them to give them a second chance. Road traffic accidents happen nearly every day, and in Zambia, it's something unspeakable. But well, what saves them is blood transfusion. There are many other patients that survive from blood transfusion and depend on them nearly weekly or monthly, and sometimes every day. Well, welcome to Hello Doctor with Dr. Gordon Chiluka, where I get to answer your questions about health, nutrition, fitness, and your general well-being. Together, I make you make those informed decisions about your health and hoping you can get to live longer. Let's go on a short commercial break so that we can discuss about blood transfusions and anemia as we continue to commemorate these transfusion drives that are going to be taking place this month. Well, we go on a short commercial break.
Let's go.
Welcome back to Hello Doctor, your doctor on call where I get to answer your questions on health, wellness, fitness, and their general well-being. And like I said, today we'll be talking about blood transfusions and anemia. But before we dwell into the whole concept and understanding what it is, we need to discuss what is blood. Well, blood is a tissue that lives in your body. So this blood is made out of different components and essentially has got many functions, but for the purpose of this discussion, I'll just trim it down to two things: supply nutrients and oxygen to your cells and removing waste and toxins from your cells. Of course, blood has got other parts of other functions that we'll get to talk about. But let's just look at the composition of blood. What indeed, when we talk about blood, what is composed in blood? So blood is simply composed of a liquid part and a solid part. When you look at the liquid part, is what we call plasma. So when you get blood, when you go to the hospital, they take it to the lab and then they do what we call a centrifuge. When they do a centrifuge, it's just blood spinning around in a small machine. This is what is going to appear afterwards. So blood is going to be separated into components. So those components is what I said, the liquid part, which is plasma, is about 55% of that volume. The 1% that you're seeing there is what we call now the solid part, okay? And the other part, which is just down there, is red blood cells, medically called erythrocytes. Okay, those are like 45%. So now when you look at the erythrocytes, it's simply the red blood cells themselves. Now, cells when you look at the white blood cells, this is the immune system that you have as a human being. So when you're fighting off those infections, malaria, and many other diseases that you can have, those white blood cells are what help you to fight those foreign bodies. And the rest of the part is plasma, which sometimes 90% of which is made out of water, has got proteins in them. And we'll talk about a very important protein called albumin because, well, albumin and hemoglobin are some of the things that we look out when you're doing those blood tests. Especially hemoglobin, when we begin to talk about anemia, most of you sometimes that is in relation to hemoglobin levels because that is a very important protein that we have. Well, let's go on. We've talked about blood and its composition. Now let's just get to look at the blood geography. I know you're wondering what is the blood geography, but it's just a simple term I'm trying to use so that I explain it to you when we talk about blood geography. So blood geography, we're talking about how blood is formed and how it is used in the body. So Blood actually is made from your bones. Amalong bones atwakwata amafupa. Emofuma mulopa. Not fira mumfati ngona Coca-Cola na shani. Blood actually comes from your bone marrow. But when you're a child, blood can actually be manufactured from your liver. So I know you're wondering, but how? Anyway, as the baby begins to grow and mature, they stop producing blood from their liver and goes to their bone marrow. And this is because of an important protein that we call erythropoietin that is found in your kidneys. So now I'm sure you're understanding why people who've got kidney failure end up having anemia or need blood transfusion. This is because there's the production that is being produced of erythropoietin from the kidney is very low. So this will mean that your bones cannot produce that blood that you need. So I now understand how this concept is coming together. So now let's also understand and go to the white blood cells. So the white blood cells, there are different types of white blood cells. Okay, you have what we call monocytes. Okay, you have what you call lymphocytes, eosinophils, basophils, and all these just work differently to protect you from foreign bodies. Lymphocytes, CD4 counts, those actually come from the lymphocyte because you've got what you call the B cells. Okay, when you go down into reading, you understand that, oh, these actually called the helper cells in some way. Now you understand why every time you go for an HIV test and you find positive, they'll tell you to do a CD4 count. You're just simply looking at the different types of the white blood cells that you have. Ngana allergic reactions, I'm sure oh, am I eosinophils now fuller? That's just simply different types of white blood cells that are trying to protect you from all these blood types. So now you're wondering, okay, you've understood about blood. What next? Well, let's now talk about anemia. In a simple term for you to understand what is anemia. So anemia is simply the reduction in the quality of blood or the quantity of blood. So now we're talking about quantity. Okay? And we're also talking about the quality. Remember we talked about red blood cells. So those red blood cells that are being produced, okay, are they in good quality for them to carry oxygen? If you remember, blood itwala oxygen kuma cells. Noxenda, I don't know how I can explain it in deeper term, but if you or toxins away from those cells to the kidneys and other cells, and other tissues, so that they're excreted out of the body. So now, if that quality of the blood that is being produced is not enough, we can actually call it anemia. So now you understand what anemia is, right? So now let's get to look at what things can cause this blood to be reduced either in quality or in quantity for you to understand the causes of anemia. So let's just get to look at anemia in different. Of course, there are many classifications that anemia can be classified based on causes and all that. But for now, let's just look at anemia itself. So what you're seeing on screen is simply symptoms of anemia. So ngatanda tumulopa nawo chepa tuishi bashana ku hospital nangumwebe nekunganda kutumwa ese bashana tumuntu nakwata anemia. Okay? But before that, let's go back to the classification. So anemia, when you go to the hospital, most of the time we use what we call an HB level, okay, which is the hemoglobin. HB is just a small definition of hemoglobin, okay. Usually, men and women have got different HB levels. So for women, usually when you have an HB less than 12, we would say you have anemia. For men, when you have an HB less than 13, we would say you have anemia. And in pregnancy, because ngana mkwate fumu, okay, umulopa nawe na shani ora chinje fwa mumulopa. So umubiri, sorry. So now when you have an HB of less than 11, then you can say you have anemia. So from here, at least you're able to understand and say, one digit, anemia. It all depends on whether you're male, female, and the biological state that you're in. Are you pregnant or not? Okay? So now, here's just a small classification that you're seeing down there at the bottom. Okay? You have what we can call microcytic anemia. Okay? Microcytic anemia, what we're simply saying is that the cells that your body is producing, or the red blood cells that your body is producing, are very small. So when we talk about micro, economics, when we talk about microeconomy, we're just simply saying it's small. Okay, so the red blood cells are small. And one important anemia under this category is iron deficiency anemia. So I'm sure I'm in hospital and but ferrous. Yes, it's because we've seen that your body has got small cells. So we're trying to make them normal. So we'll give you ferrous because you've got iron deficiency anemia. So we'll give you those tablets. Sometimes you hate because of the smell or whatever color they have, but it's important because iron deficiency anemia is very common in our community, all right? Then you have normocytic anemia. In normocytic anemia, to learn the fact, ama cells that your body is producing, they're very normal, okay? Literally everything is normal about them. But here, the quantity is smaller. This can happen in road accidents. So you have an RTA, and then you've lost a lot of blood. Most often, you're going to have normocytic anemia. Why? Because your blood is normal. The only thing that has changed is that you've poured out a lot, okay? And I'm sure now you're getting the concept. So now we've talked about microcytic anemia, normocytic anemia. Then now we've got what we call megaloblastic anemia. If you remember that cartoon, Megamind, how something was big about him. I don't want to look like I'm discriminating anyone, but something was big about Megamind, right? Obviously, mega mind. So, meaning mega is something big. So here now, the problems at your cells are a lot, okay? Nafi fuller in terms of the size. So here, one of the common causes is vitamin B12, okay? Mwebengi, I'm a vegetarian, you don't take ample nutrition, and you can end up having anemia. I'm not saying it's bad to be a vegetarian, but I'm telling you that you need to have the right diet to make sure that you have all those nutrients that you need as a human being. Okay, so megaloblastic anemia is very common in our communities, yes? Especially when those that take alcohol in excessive quantities. You find that you end up developing anemia. So anemia has got many causes, but now let's just get to look at the symptoms so that you understand to say, oh, okay, you have anemia. But a disclaimer, remember that this show is not here to take away the need of seeing a doctor. I'm just here to explain to you simple concepts about health to make you have that decision, that is informed when you're making those decisions about your health. So when you look at these symptoms, some of you don't start looking at yourself and say, anemia. No. These symptoms can also present for various diseases. However, these are just some of the things that help us, doctors, to just give an overview and understand, are you having anemia or not? So remember, always visit your physician or your doctor whenever you feel sick. Don't just tune into this show and make a diagnosis on your own, and then you go to a pharmacy and then you buy medication. You could end up killing yourself. So let's look at the symptoms of anemia. People can have broken hair or hair loss. So you're just losing your hair is just breaking because it becomes brittle. Some of you will have difficulties in breathing, so you find you just walk a short distance. Okay, you're just getting out of bed, going to the kitchen, you're already failing to breathe. Those could be symptoms of anemia. Okay, heartburn. All of a sudden when you eat, you're just feeling something hot around your throat or your chest. The many other symptoms that you could have, let's talk of headache, okay, sometimes that's passing at nafenta. Those could be signs of anemia. And whenever you develop these symptoms and signs, it's time to see your doctor. Of course, you can call in hello doctor, but don't forget to go to your local physician, because they can do some tests and make sure that you make a right diagnosis and a treatment plan for you. So not kula tumafia phone mwekara kunganda. You know, na tumina ba hello doctor pa TV, wala ask questions. No. Make sure this is asked for information purposes. Okay? So now, let's get to look at, blood types. We've talked about blood. We've talked about the different types of blood, like what cells that are coming there. Let's look at blood types, because I'm sure I'm moving from forfeit. In neighbor group A, in neighbor group B, in neighbor group, whatever group you've been told you are. Let's get to understand what are these blood types. So around 1930, an Australian physician, okay, he discovered these blood types. It was a very brilliant discovery, because it ended up him winning the Nobel Peace Prize in 1930 because of this discovery. So he simply just categorized blood cells into group A and group B and group O, which is something that we're still using today. Okay, so when you look at this, there's on the screen, you're having the blood cell type. Okay, but now let's just go down to the types themselves. So you have group A and group B and group O. In group A, what you simply have to that antigens, yeah, A. And then you have got antibodies. Remember, we talked about white blood cells. These white blood cells fight foreign things. Okay, so if you have blood group A, it simply means that what? You have antigens A and antibodies B. Just like that and vice versa. So let's just look at now compatibility. Okay, what we simply mean now, when you get to look at blood transfusion, ngamwaya ku hospital randa to kurefu akomulopa. Ushibapera fyumulopo wonse basende basende mu aboyu, wabikomu, wasende B, wasankanya na A. Let's just get to look at those combinations or compatibility that you begin to have when you go to the hospital. Okay? So, I'm sure you've heard, oh, me, I'm a ndapokomulopolu wonse, oh, nenda pero odu wonse. It simply means, so if you are a donor, a universal donor, okay? A universal donor simply means you can give anyone. So blood group O is a universal donor. So blood group O, you can give blood to literally anyone. Of course, at the hospital, they'll do certain tests to make sure that blood is what? Is safe. And we have an expert who's going to discuss about all this in studio. If you're a recipient, okay? Your recipient meaning you're receiving, people with blood group AB are universal recipients, meaning they can receive blood from anyone, whether you're an O, you're an A, you're a B, you can receive this blood. Okay? So now you understand, and now I want you to walk away with at least two terminologies. Universal donor, universal recipient. Universal donor is blood group O. Universal recipient is blood group AB. Don't confuse this. Remember, this is for education purposes. So don't try and master this card and then want to be a doctor and diagnose yourself and then go to a doctor and say, I know, and then therefore blood group O because I'm quite deaf. This is for information purposes. And don't try to transfuse blood on your own because there's an RTA, then someone has lost blood. Don't try to be a hero. You may end up killing the patient. Okay? We'll have another segment where we can talk about first aid during RTA. But for now, let's just concentrate on blood transfusion itself. So let's go on a short commercial break where we can now invite our guest. And this guest, funny enough, was my lecturer in pediatric and taught me all these concepts about anemia. So I don't know if it's going to be a rematch or let's see what happens. But let's go on a short commercial break and then we can discuss more on anemia and blood transfusion.
Wow me.
Welcome to Luna Lifestyle TV. You didn't know you needed us until now. It's lifestyle, but we make it legendary. From smoothie goals to the core that scores. We're not just here to show you how to live better. We're here to make you say, wait a minute, do people actually do that? Wellness meets weirdly specific goals, and your vibe meets your tribe. You have now entered the Luna Kitchen. Side effects may include an appeased appetite and the desire to do it yourself. So go on, live light, live bold, live Luna.
I should have turned this on long ago.
Hello guys, welcome back to Hello Doctor, your doctor on call, where I get to answer your questions on fitness, health, nutrition, as well as just your general well-being. Today I'm joined in studio by Dr. Mubita. Fun fact that you should know, Dr. Mubita was my lecturer of pediatrics when I was in medical school, and she wasn't a bad person, like I said. She was really a good person, and I mean, she did some wonderful stuff, and I'm here as a registered doctor, helping you guys have those health decisions. So I'm going to let her introduce herself.
Thank you, Dr. Chiluka. Dr. Mubita. Mwaka is my first name. I'm a pediatrician and child health specialist at Arthur Davison Children's Hospital. I head one of the units that looks after general patients, but in particular our patients with blood disorders. So thank you for having me here. Really, really happy to see you in that seat.
Yeah, I'm also happy because if you ask me back then if this was my dream. Having my lecture on set was not out of the things. It's actually out of the blue moon, but I mean, life is life and we're here. I'm just glad for those times.
No, now you're gonna be the one examining me here.
Yeah.
In
Anyway,
public.
speaking of examining, let me throw my first question. So today we're just talking about anemia, and we're trying to look at blood transfusion. So as an expert, I know we had a small breakdown in the earlier segment where we talked about anemia, but how would you just describe it from your end?
Okay, so I think in the medical field we always describe anemia not only in terms of quantity but also in terms of the function, and you already elaborated so well on the function of our red blood cells. So anemia is basically a reduction in the number of red blood cells in the body, but we do go on to further just elaborate on what that means. So we, like you said, the function of the red blood cells is to carry nutrition, but also oxygen as well.
Yeah.
So when this function, when you have the reduced red blood cells, then now you actually have a problem with the way they're supposed to work. So you're not carrying enough oxygen. You cannot also carry enough nutrition around the body, so the metabolic demands of the body are then compromised. So that's basically what anemia would be.
Alright, so these questions often come from our viewers. So, one of the misconceptions that people have is that every time you're diagnosed with anemia, you need to get a blood transfusion. How true could you speak to it as an expert?
So, again, I'll just, you really elaborated so well on so many aspects when it comes to anemia. And again, like you said, there is a cutoff point for when we define anemia, and it depends on your gender, and it also depends on your age. Yeah. So even in children, like I said, I'm a pediatrician.
Yeah.
So even with our children who are less than 5 years, who are a little bit older, those who are infants, we have different cutoff points, and that's the same thing. So we do classify it as mild, moderate, and severe. With severe anemia, we will give a blood transfusion in most cases. Again, it depends on the cause of the anemia, which you also outlined as well. That's so important. So it's not every patient with anemia or every person who's diagnosed as having anemia who will need a blood transfusion. We have to look at the cause, and then we also have to look at what is happening with the body as a result of that anemia, and that would determine if we should give a blood transfusion.
Well, there's a very common misconception, and even as a student, I got to experience this on the wards. Every time you go to to a mother or you go to a child and you want to remove blood, and say, so just speak of it. Those blood withdrawals that we do to mothers, and the blood transfusion. So if I go and say I want to donate blood, does it reduce my blood levels? Do I also need a blood transfusion later on because I've removed blood from my body? Just speak to that. So,
we have liters of blood as an adult, and usually when we take blood, we're just taking a few mils. So the great thing about the body is its capacity to just regenerate that plasma. You already broke down the different components of blood, and plasma, which is the liquid form, is the biggest component. That is restored within 1 day, 2 days. You're already restored. And then now you have the red blood cells, which that occurs just over a few weeks. So imagine we're just taking away that little mil of blood in order to actually do something that's life-saving for our patients. So that's something that we always try to explain, so that our parents and even us as patients, adult patients, are on board with what's going on.
Yeah, that's very important, because if I remember from my lecture slides, a human body has about 5 liters. So we're talking about an average human being. Let's give them a kg weight of about 75. They will have about 5 liters of blood. Okay, and every time you go to the hospital and we're trying to withdraw those bloods to see and just do a diagnosis, we only get about 2 mil, max 5 mil, maybe even up to 10. So if you look at 5 liters and then you remove 10 mils, that's not something that you should worry about as a patient. And if you're talking about blood donations, 1 unit could be about 480 mils.
480.
Yeah, so the misconception about losing blood and all that is probably a myth. But anyway, you talked about blood production and it being produced in a very short time. There's also a lot of talk around people, especially our elders. They believe that certain foods get to increase your blood levels. So even when I was a student, when someone is admitted, you'd find that Jolly juice, just because it was red, you'd find them doing concoction of Coca-Cola and they put eggs and they would say Bondwe. There's a whole lot of from my end that I've heard. I'm not sure what you've heard as well, but just what you've heard as well, and what is your expert opinion about all these foods? What foods really boost your blood, and what are the myths and facts?
Okay, so like we say, when it comes down to the anemia, you have to investigate what's causing the anemia, and then you would treat as such. So we usually find that a lot of patients may have iron deficiency anemia. And I think that's why over time, though it's gotten lost in translation, we encourage certain iron-containing foods. So your red meats definitely have a lot of iron in them. Even your chicken, but not as much as the red meats. And your dark leafy vegetables also have some good iron content in them as well. But this comes down to what I'm saying. Not everyone is walking around with iron deficiency anemia. There's so many other causes of the anemia. So we will encourage people, yes, if they have iron deficiency anemia, just to eat more of such foods. Also, fruits are also very important.
Okay, let me just do that for you. Yeah, you were saying.
Yeah. So fruits are also very important because they have they have vitamin C. Vitamin C helps in iron absorption as well. That's why we will say take some fruits as well. And then obviously we'll add certain supplements, folate and things like that. I will give a very practical example. With patients with sickle cell disease, they tend to not have iron deficiency. So we'll give them folic acid because that helps with the production of the red blood cells. Only if we determine that there is also iron deficiency will we give some iron supplements. So it's very, very important to really determine the cause, and then but we do encourage healthy eating, nutritious eating. Yeah, always important.
I've seen other people also take chicken liver as well as liver from beef.
So liver does have a high iron content. That one does have a high iron content. So it really is advised again in patients who may have iron deficiency anemia.
Anyway, there you get it. So it's not all the time that you have anemia. You need to get yourself on those iron supplements, or you need to drink those drinks that you drink. That probably is just a myth. But make sure that you see a doctor so that you're told which type of anemia that you have. And from there, it's gonna be easier for you to get on the diet that is gonna be prescribed for you by the doctor, hand in hand with a nutritionist. So when you go to hospitals, we even have nutritional experts. So yeah. But anyway, talking about blood donations, who can donate blood and who can't donate blood?
Okay, so with blood donations, we want healthy adults to donate blood. So those who don't have any chronic conditions, those who haven't been recently sick, no fevers, recent surgery, pregnant women. We also advise those who may have recently had a tattoo or piercing to not donate blood. But a healthy adult between 18 up to about retirement age, provided they don't have any other comorbidities, can safely donate blood.
Okay. Yeah. So I know there's a blood donation drive that is coming up, and just as you get to talk about it, many people that want to donate blood obviously have got one question in mind: what are the risks I may face if I donate blood, or what may I face, presumably? So would you have to speak about that?
Okay, so I think like we already said, like we said earlier, the body does regenerate your plasma and your red blood cells in a short time. So we always just advise good hydration, take a good snack as well that day.
That's why they give us sugar.
Yes.
And milk.
Have a good snack. We'll give you biscuits as well.
Yeah.
So just have a good snack, have some good hydration, take rest that day, and by the next day you'll be up and about. You can go about your business again. We just want you to rest because, obviously taking a bit of
blood from you. If I come to the blood.
We will not give you a sick off. We will just give you a little sticker to say, you donated blood, so back to work you go.
And speaking of the donation drive, maybe this is the time we can get to just tell the people what really is going to be taking place so that they understand the concept behind this program as well. I mean, this episode as well.
Okay, so we know that our population has really drastically increased over the years, and that also just means that we're seeing patients presenting with all sorts of conditions that actually require blood transfusions. So with blood, obviously it has a shelf life. I think I'll just say it as in simple terms. It has a shelf life. With your red blood cells, about 40 days. 40 days. So
it's like a month. Huh?
Yeah, a little bit over a month. Yeah. And we know that people are sick every day. So it's not only the people who have accidents who need blood, but pregnant women may bleed a little bit more and they need blood. We have a lot of patients on the pediatric side that come in with malaria, severe infections.
It's something very prevalent, especially in the copper belt.
Yeah.
Many of the times, patients will come in with already severe malaria and don't need a blood transfusion.
Yes, because they come in, so malaria affects the red blood cells, causes them to break down so quickly. And we see very severe cases where children may come in with an HB of 2, and I would imagine it's also the same on the adult side. Even when I was an intern working at Ndola Teaching Hospital, it was the same. You see patients come in with severe malaria and they're really low HBs and they require blood. So it's really just to say that there are a lot of reasons why we need to give blood. We are seeing a rise in our diagnosis of cancer cases. A lot of these people also come in already with low blood levels, or even their treatment, how it really affects the body, or they may need a supportive treatment and they may need blood as well. So it's some of those cases and many more that require blood, and that's why we've seen this partnership coming up with the Zambia National Blood Transfusion Services, as well as our partners in the community, and coming on site to our hospital. We're privileged to host them and just have this blood donation drive, calling as many people as possible so that we can boost our reserves. So it's going to take place on the 30th of August, Friday the 30th of August.
Is it Friday? Could be a reason to miss work.
I'm not going to say anything, but please come and donate blood. That's why we're really just talking about the need. We've seen, like I said, increased population, increased burden of illnesses, and with that comes the need for more blood for our patients. It's part of treatment.
Maybe one of the questions one would ask is it just going to be one day off thing, or even today can I stand up and say I want to go donate blood?
Yes.
Okay.
You can actually go to a facility near you, and you will be directed as to how you can go about donating blood. We encourage regular donation, so you can donate almost every 3 to 4 months, about 4 months for women, for obvious reasons, and men, healthy young men, about 3 months of between your blood donations. It's a way to do something for humanity, for the community. Yeah.
So you can actually be a superhero by going to a facility and donate your blood. Don't try to be a superhero outside that facility, because you may end up killing the patient. So I want to see a lot of superheroes going up and setting up, not only for young children at Arthur Davidson Children's Hospital, but even for adults, because when you donate that blood, it goes a long way. You may not know who you're saving, but you never know. I just met my old lecturer, or my former lecturer, on my studio. So you never know. Maybe the person you could be helping with that blood donation could be someone to give you a ride as you're going to Kitwe, Lusaka, you never know, but just don't donate because you're trying to get back a favor. Donate because you're trying to see more people live just like you're living and give them a second chance. So let's wrap up by just looking at a myth or a fact. So I'm going to read out some statements and I want to hear from you if it is a myth or a fact. So let's start with number one. I mean, we talked about food. So, yeah, just taking beetroot increase your blood levels. Myth or fact?
Myth.
Okay, that's a good one. Let's go with okay. How much blood do you lose when you go to a hospital to donate blood? Is it 450 mils? Myth or a fact?
So, facts. You donate 450 mils, which you will recover very shortly.
Well, another myth or a fact? All road accident victims deserve to be donated to blood.
Myth.
Okay.
Not everyone is going to bleed out because of a road traffic accident. But again, like we always say, that is guided by the clinical presentation, what the doctors find, and then they'll determine whether they need to give blood to the patient.
Okay, so myth or a fact? Donating blood makes you weak.
Myth.
I love that one.
It's a myth. You like we said, just hydrate and you're gonna be okay. You're gonna replenish your stores very shortly.
Very shortly. Anyway, I'm one of the last. Any blood type can donate to anyone. Myth or a fact?
Myth. So I only say myth because we as healthcare workers are definitely going to test for compatibility, match the blood groups. We do further testing, compatibility testing, and even extended testing. And we definitely screen for infections. And again, we monitor our patients who are receiving blood, very close monitoring to make sure that they're receiving that blood well.
Okay, another myth or fact. Can all your siblings donate blood to one another?
Myth. Yes, because it depends on, I think you broke it down very well about the blood grouping, and you have to remember that parents already may not have the same blood group, and then you just have kids that just go anywhere. So you have to test every sibling. I
mean, I asked this because I remember one of the times when I was a student, we had this mother who needed we had this woman who needed a blood transfusion, and among us her two siblings, none of them could donate. So people thought she was very greedy. Like, my sister. So I mean, it's a good thing to learn that it's actually a myth. It's not all the time that your siblings, even if you're just a 12, you could mean that you have the same blood group and you can donate to each other.
One's A, one's AB, one's B. It's just
it's a whole lot of
so that's why we test. That's why we do the testing. So
anyway, it was a very good segment to have you and get to talk about anemia and blood transfusion. But in a wrap up, what would you tell the people watching for today? Just anything about anemia, blood transfusion, and the drive that is taking place.
Okay, so I think we've already talked about symptoms of anemia. We've talked about the fact that anemia must be investigated. More than anything, we are seeing a large number of people that are needing blood. So please, if you're healthy, please get, and you're a healthy adult, please get to a facility near you. Come through to Arthur Davison Children's Hospital on 30th August and donate some blood. You don't know how many lives you'll be saving just from your 1 unit of blood.
Anyway, that's a very good one. But anyway, we are wrapping up the show, and I'm hoping that, dear viewers, you got to enjoy your show. You learned one or two things about anemia, blood transfusion, and you learned something about all these concepts that we're talking about. Well, now we're about to close the show, and my words to you is, remember, I'm going to give you a healthy fact for today. Take your water. I know you've heard this, but take your water. Even if it's cold, remember, take your water and save your kidneys. That's one healthy fact that you have for today. And from me to you, it's bye-bye from Hello Doctor, your doctor on call.